Okay. So the one thing that I just looked at, remember, I sent through what we call the bento feed forward box, and that is to get some feedback in semester. Normally, at the end of the semester, we ask students to complete what we call the SETU, which is student evaluation. And that is normally the response rate is not too good, but we really try to encourage students to complete that. But normally, because it's at the end of the semester, we can't make any changes at the end of semester. We can make changes going forward. So the bento box, the feed forward bento box, which is more or less in the middle of the semester. So it's an in-semester way of trying to get feedback. So if there's anything that you think we can change, that any concerns that you have, we can actually use that and make changes during the semester if we think it would be appropriate to make those changes. So that's actually why we have the in-semester feedback as well. Now, I've looked and I've seen one person has done it, so I'm not going to ask who did it because it's anonymous. But I could see that all the tick boxes were above average, but there were no comments. But now that we have both of you, is there anything in terms of things that we do well or things that you think we can do differently? So, Madeline, can I maybe start with you? And while we just want to congratulate you again on your award, your scholarship that you got from ASMED.
Thank you.
So that is duly recognized in our department as well.
Thank you very much.
So, Madeline,
Um,
any thoughts you've now had, and we're just focusing on 5108 because I know you're in 4502 as well. So, any thoughts about what you think we do well, or anything that you think we can maybe do differently?
I like the fact that the content is uploaded steadily and yet sort of still in advance to each week. It means you're not going to sort of rush through it all at once because it is all available. But then with it being available prior to the weekend or something, depending on the shifts that we have, obviously everyone works different jobs or is in different time zones. So it's nice that it is available. Um, with my current roster, I haven't necessarily worked through, I think, this week's things, and I haven't done the formative exam yet, but it is nice that you obviously provide the feedback to it so that we can learn from like, what we've done and it is a learning experience rather than just you got this right or you got this wrong. So
So do you
that's sort
feel,
of all I have.
Madeline, that would you like like to have more material available to you at any one time or no?
Not necessarily. I think if too much information is available, then you kind of would sort of blitz through it when you have a period of time to do it. And then that's not necessarily valuable adding to the learning experience, particularly when the exams come towards the end of semester, because then you've already done it, but it was however many weeks ago. So I think spaced out as it is, but like prior to each weekend. So it's still early for the week. But yeah.
Yeah.
So you think the workload is quite manageable the way we are delivering it at the moment?
I feel so. I am doing the course part-time, so exactly as you said, I am doing one of the other units as well. Um, I think if it was obviously to take on a full-time course, I would probably be a bit more stressed. But as part-time and the way that you have spaced things out, particularly with the assignments and exams on different timelines, it sort of is manageable to keep up with.
Okay, good, great. Joanne, what about you? Any comments from you? Because you're in a total different time zone.
I'm 2 hours after you. So now is, or rather, how should I say? Now it's like 4:39 p.m.
4:30.
Okay,
So
Okay.
yeah, so 2 hours after you.
okay.
Yeah, ahead. So it's nice to have the announcements every end of the week. When I wake up, I said, oh, okay, that's what
This
I
is
have
what
to
I
do.
must do.
Yeah, so it's a very predictable kind of timetable, and I appreciate that. because with that, as for Madeline, I suppose you also have to, work and study. So we really have to be organized in our schedule. And I really appreciate when you don't give us any more reading when we are supposed to submit assignments. Yeah.
Yeah, especially
So
with the ISAP, with the big one, the CAP reports, we don't give any material, so because so that you can have enough time to work on that.
yes, and the break last week was very much appreciated.
Mm. Yeah,
Yeah.
that's why the university has mid-semester breaks so that students can give their brain a rest.
Yeah, or catch up on, material that you may not have got to.
Actually, I went to Australia.
And you
did you?
didn't come visit us.
I went to Rottnest.
Oh, I
To
see.
Rottnest.
Okay.
Yeah, I went
See the
cycling there.
quokkas.
Yeah, I went cycling there, and yeah, not bad.
Okay.
And I fell from my bike, so I know what's a serious mechanism of injury.
And you survived and you're okay?
Yeah, it was good. Luckily, I had my back to cushion me.
Okay.
Because Rottnest has the, slopes. Yeah,
Okay.
so yeah, first-hand encounter with a bike accident.
Okay.
Yeah, but that's post ISAT. But I, with this kind of comparative reports, it makes me really reflect on how I read things and apply it to clinical cases.
Okay.
And yeah, I suppose divine intervention, they want me to experience it. So yeah, that's why I fell.
Can I ask you, because you're from Singapore, right?
Yes.
And in Singapore, I know definitely at one of the hospitals, they've started implementing either the red dot or providing a preliminary comment. Is that the same for you?
We haven't started.
Oh, okay.
Yeah.
Yeah, I know. I can't
Uh,
remember the hospital. It is close to the airport, that big
yeah.
hospital. Yeah, so they've
Yes,
started.
Changi
Changi,
General.
that's right. Yeah.
Yeah.
They've started implementing, providing comments as well. Yeah, because we've got one of our graduates who's instrumental. She came and trained with us, so she's quite instrumental, in pushing that forward as well.
Amanda?
Yes.
Okay.
Yeah. So you
A
know her.
small world.
Yeah.
Mm,
Yeah.
okay. Yeah. So that's for schedule. And uh I also realized with the opinion forms,
Mm,
the small exercises that you ask us to, just test ourselves, right? Then you give us feedback. I think that's very helpful as well.
okay.
Yeah, and with that,
So that's
uh,
the formative test is
Yeah.
that,
Yeah.
uh,
yeah,
Yeah. So now
yeah,
and again, I give practice banks, not just the
mm,
formative
or the
test.
practice. Yeah.
Yeah.
yeah,
And then
Okay.
some feedback on it. Yeah.
mm. So with that, I had some idea, like for example, in the formative test, I use the format of the opinion form
Okay.
and organize my thoughts. Like,
Okay.
soft tissue, alignment, bone
Yeah.
joints. Yeah.
Yeah, so it's the reason why I give that opinion form is so that you get used to, having that systematic approach, where you've got the ABCs. But the one thing you've got to remember when we actually do the exam, so the exam will also be similar to what you've now seen with the practice banks and so on, but there's 3 marks for each, more or less 3 marks for each of the cases. And then you can't write on all the ABCs. And what I normally say is with those exam, you mention the ones that's important. So if there's a fracture of the bone, that you're going to mention that. If there's a soft tissue sign or if there's something wrong with the joint, you mention that. And if it's a normal case, you can't just write it's normal. You've got to justify why you say it's normal. You could either say that there's no evidence of any fractures, or there's no soft tissue signs that would indicate an occult fracture, something like that. So they're more or less 3 marks per case. But it's the main thing about using the opinion form is to get you into thinking that systematic approach, so you check everything as well.
Yeah, and for that cervical spine, which you say was NAD, I thought the joint space was a bit narrowed, and I was just, looking at that, and as time is ticking, right, I was like, okay, so when it's like real exam, do I really have that kind of space to keep on thinking, like, and overthinking whether the first case is normal or abnormal? Because I thought there's a little bit of narrowing, and as compared to the other one where there's widened space. Yeah. So when you say there's widened space, then yeah, an overhanging of C1 to C2, right?
Yeah.
So I suppose, I don't know, maybe more image banks for me to practice. Yeah.
Yeah, you know what Tony mentioned, I don't know if you remember, Tony, in that CM RAD, the one where they can register voluntary. They mostly have pathology cases, hey, not normal cases, right, Tony?
Yeah, that's collective minds, you mean? Yeah, that's correct. Yeah,
Yeah.
they've all got pathology of
Yeah,
some.
yeah.
Some of them know it's very hard to see the pathology.
Mm.
And I think the other thing I find with collective minds is that you don't get a clinical history. You get gender and age, but
Okay.
yeah, you don't. Or sometimes it does give you a hint, like it'll say query fracture or something like that. So obviously it's traumatic, but yeah, and but more often than not, there's no clinical history, and so it does actually sometimes involve a very bit of very careful, you know, interpretation.
Sure, and I also wanted to say, now that Tony mentioned the clinical history, so the main thing is, so if it is some query fracture, query trauma, there might be some of the pathologies that's not actually important to the clinical indication. So the main thing is to focus on what is the clinical question. Can I answer the clinical question and focus on that? Because there could be some chronic changes like arthritic changes and things like that that is not really answering the clinical question. So be aware of that you focus on the clinical question. However, you might sometimes find incidental findings, which is not related to trauma, but which has an impact on the management of the patient. And then you've got to mention that as well.
Okay, I see.
Yeah.
Okay. And I was also reflecting as, I go through images. I realize I tend to have more false positive, false negative. Like, as I start, so I suppose the false positive is overthinking. Then
Yeah.
false negative is not so careful.
I think it's actually quite natural. I remember when I went and did my master's degree in the UK, I came from South Africa with very little experience in image interpretation. I overcalled on everything when I started. Everything I thought should be abnormal. There should be something wrong. And that is quite normal, when you start with image interpretation, to overcall until you get used to what is normal and what is abnormal. And there are these normal variants as well that you've got to think about. You've also got to think about the age of the patient as well. Your pediatrics looks different. Your elderly patients look different. Yeah, so I know I overcalled at the start, and there's, I think Tony will agree, there's stats there that supports, when you start on this journey, initially you will overcall, but we try to minimize overcalling by doing actual training around that. Because when you overcall, and especially if you work in an environment where the radiologist can't give an immediate report and they ask your opinion, then it might be that the patient is now sent for more imaging, or that they might actually act on your opinion, although we always say it is a radiologist's report that they need to act on. That yours is an additional support. That's our message at the moment in Australia.
And I had
Yes.
some, I don't know, issues on the thickness of the pre-vertebral tissue for cervical spine.
Yeah.
Not so confident in that. Yeah, I don't know whether you have any tips on,
Tony,
for
can
that
you
soft
maybe
tissue.
talk that one?
Yeah,
Yeah.
yeah. I mean, it was pretty borderline in that particular case, but it looked like there may have been some slight widening of the prevertebral soft tissues lower down in the cervical spine. So not at C1, C2, C3, but at C6, C7, there appeared to be a bulge, if you like. And I think the comment that in the expert report was there's something like the suggestion of a slight widening of the prevertebral soft tissues or something along those lines. So it's being a bit, having a bit both ways, as we say, just not, being a bit equivocal, I guess, about whether or not there is any soft tissue widening, but more. I mean, it was backed up by the fact that there was actually bony injuries at 2 levels on that particular case, and yeah, it's sometimes tricky, and it's not easy to decide whether. But if you look at the width of the vertebral body in the lateral view, look at the width of the vertebral body, and then look at the width of the prevertebral soft tissues, and compare those two. They should be about the same. They won't necessarily be exactly the same, and also sometimes, certainly with those images that we gave you in the ISAP case, you couldn't actually put calipers on them and measure them to actually see whether or not it was actually 2 centimeters or more or less, at that level. So that makes it a little bit more tricky as well.
Yeah,
So
unfortunately, sorry, Tony, I should have mentioned, because the majority of images that we have are JPEGs. We don't get DICOM images. I think, Tony, you also, all of your cases are DICOM images. So
yeah,
it measures in pixel size. It doesn't measure in millimeters, but it gives you kind of an idea whether it's more than or less than. It just gives you some idea, but it doesn't measure in millimeters.
no, unfortunately, but yeah, so
Yeah,
it's
because I
really,
remember the opinion form for the cervical spine, the one where Imelda was saying is positive. That was like, okay, but I have to, just take your word for it and then try
Can you
to figure
remember
it
which
out.
case it was? And I can look at it and give you more feedback afterwards again.
Okay, sure. Yeah, I
If you
will.
maybe send me an
Yeah,
email and I
sure,
look at
sure.
that one. Yeah, yeah,
Okay.
yeah. Because I
Yeah, the
honestly
one that
can't
you say, you have to measure, you have to take it out and measure.
Yeah, yeah.
Yeah.
But as I say, because they are all JPEG images, the thing is, the reason why we get JPEG images from clinical centers, because they want to anonymize everything and they don't want to give the DICOMs. So basically, all of the images that I have for plain X-ray are JPEGs, and that's unfortunate.
yeah, same here.
Yeah.
But I think, for the ISAP case, just going back to that, I think you both did well. In fact, I think all all 5 of the students in this unit did well,
Yeah.
with the ISAP case, and it wasn't an easy. it wasn't an easy case, and it's also, I think, not common that we're seeing plain cervical spine radiographs anyway. Although there were some CT images in that case as well, but I think yeah, so it did sort of stretch people a little bit, but that's okay, because I think it's like practice in just having a structured and methodological approach and thinking about what you need to do in terms of musculoskeletal image interpretation anyway, sort of more broadly, general terms. Yeah. So yeah, no, you both did well. So
Yeah. And then now just with the clinical portfolio, I know the students focus a lot on getting pathology, but don't forget, you must also have normal cases.
how are you going with your portfolio images? Are you collecting some already?
Madeline, how are you doing with that?
I have gone through my department packs and found a whole bunch of studies, and I've copied them and made sure I've got the radiologist reports.
Good.
I hope I can remember which report is to which patient. I can't remember if I noted that down properly or not, so I might have to recheck that. But I have the cases. I just need to obviously start interpreting them and put that together. So
Yeah.
Yeah, because that actually takes a lot of time.
yeah.
Because you've got to work out, that audit, whether it's true positive, and then you've also got to do the table afterwards as well. So even if you just do a few, especially you coming towards the end now, yeah, so start writing up, and remember to include at least one or two images. You don't have to include all of the images. You can just include the ones that's pertinent to what you need to see.
You will have a little bit of space towards the end of the semester.
Sorry, Tony, my headphones are problematic again. Just say again.
I was just saying that they'll have some time, some space towards the end of the semester when there's a student study vacation, but that comes sort of close to the exam period. So you've got the exams as well. Are you hearing Imelda? Or
Yeah, no. So the submission of the portfolios in the last week. So they first write the exams, and then it's in the last week of that. There's a 3-week exam period. So it's in that very last week that they have to submit the portfolios after the exams. Is that what you asked?
Yeah. I don't want you to feel, I'm not trying to make you feel complacent about it, though. I think you need to keep a bit of pressure on yourself with the portfolio as well. Joanne, are you finding that you can get some images all right?
Yes.
Yeah. Okay, good. Yeah.
Are there any body regions that you might struggle to get images? Because for this one, you need the cervical spine, but then the upper limb, like the shoulder, elbows, wrists, and hands. Will you be able to get all of it?
Should be able to get everything. Yeah.
I think, Madeline, for you, it should be okay as well, hey?
I had to open my search results to a longer period of time to find some C-spine X-rays, because obviously everyone just goes to CT for the most part. But I did come across 2 or 3, I think. So yeah, that's fine.
And remember, you don't have to be the one who X-rayed the patients.
Yeah.
So you can, even if you can go back into records to try and find cases, if you struggle, you can use from your PAC system or somewhere, get cases if needed. But remember to first write up your PIE before you compare that to radiologist report.
Yeah.
Okay, so have you got any other questions you want to ask us while we are here? Anything that you need clarification on?
I I didn't come in this evening with any specific questions. What we've gone through has been helpful and valuable, but not at this point in time, I don't believe. I haven't done this week's content yet. I'm aiming to maybe get that done on the weekend, but
So
yeah, for the most part,
when you
it's all going
say
well.
this week's content, do you mean the trauma upper limb, the trauma forearm and elbow stuff?
Yes.
Yeah.
Yeah, that stuff in the formative test. I haven't gone through that yet, but that's okay. There's plenty of time.
Yeah. Well,
Yeah, and I think that's one benefits of the course being delivered wholly online. So
Yeah.
there's no pressure for you when you can do it. You can do it whenever it suits you. The only thing that we always say is don't let things become too much compressed, towards the end of the semester. So there are times when you're going to just be so busy you can't do anything else, and that's understandable. And next week maybe there's a less pressure, and you can then catch up again. So don't feel guilty because you haven't done it yet. Yeah, so because I know there's different pressures on you guys.
we have had, I think, 3 students so far and a 4th one underway at the moment who've done all 4 units in a single semester, and worked full time at a major trauma hospital as well, the John Hunter. So
Yeah. Good on them. Well done.
Yeah. I'm not sure how they manage it, but the 3 that did it previously did fine. But
Yeah.
they probably didn't get a lot of sleep or something.
No, I don't imagine so.
Yeah, pretty full on.
So Joanne, and are you okay with everything so far? There's nothing else you want to ask us?
One more question about the Freiberg-Kienbock-Pettis disease, because you was just telling us all together in one of the formative test questions.
Yeah.
Is there any reading that I missed out? I was just wondering all these processes.
Can you send me
Freiberg.
an email about the ones
Sure.
that you have questions about? And then I
Okay.
can address that for you. I might not be able to do it tomorrow because tomorrow I've got a very full day. I might only get to it by Friday. But send me an email with the ones that you've got questions, and then I will respond.
I think I can only send you over the weekend.
That's fine. It will be better over the weekend because this weekend is so much happening.
That's what weekends are for, Joanne.
Yeah. And then I respond on Monday. I try my best not to respond on a weekend because normally I sit and work anyway. But I'll normally try to do it on a Monday early.
Thank you so much.
Okay. Tony, anything from you?
No, I don't think so. I did sort of hint that I'd go through some cases on collective minds, but I don't think we'll I'm not going to hold you up doing that, or hold myself up as well. I'm hungry and ready to eat, actually. But what I will do is I'll suggest I'll put a bit of information up on the online about collective minds, and suggest some cases that you actually might go and have a look at. And, yeah, I mean, I know that you've got a lot to do at the moment anyway, but still, if you've got a bit of spare time, or you can even take them to work with you and test your friends. Yeah, Collective Minds is a free resource, so which is nice.
All right. Okay. So I'm not going to hold the rest of you up because Tony's hungry. And I think you guys must also be hungry. Okay, so thanks a lot. I will post the recording afterwards. And Joanne, send me that email with the ones that you've got queries. All right. Yeah. And all the best with the rest of the semester, with the exams that's coming up, and with the clinical portfolio. But as always, you can send us any questions, and we'll try to respond as soon as possible. Okay, all right. All the best, you guys. Okay, thanks, Tony.
Right. Take care.
Thank you.
Good night.
Bye. Bye.
See ya.